Back now with a health alert after the sudden passing of Alan Thicke. You know, he seemed healthy. He was playing ice hockey with his teenage son when he died. He attended a Christmas Day party days before suffering that heart attack, just 69 years old. Rich Besser here to talk about it. And Rich, again, you know, he looked happy, looked healthy, was out there playing ice hockey. It's not that unusual, though, for someone to get a heart attack in this situation.
No, that's right. You know, heart disease is the leading cause of death for both men and women. And a surprising thing is half of the men who die suddenly from a heart attack never had a symptom before. They didn't know it. But not all heart attacks are the same. So when you think about a heart attack, it's a cutoff of blood to part of the muscle of the heart. If it cuts off blood flow to a large part of the muscle dies and it'll be fatal. The other way it can be fatal is if it takes out that nerve conduction system that causes the heart to beat properly. You can have something called an arrhythmia. If it's not treated right away, that can be fatal.
Reports are that his son and his teammates acted pretty quickly once they realized something was happening. What should you do if you feel these warning signs coming up?
I mean, you want to act really quickly. The first thing is to call 911 because the sooner someone gets to the hospital, the more likely they are to survive. If they're alert and awake and you've got an aspirin, you want them to take an aspirin. Baby aspirin, adult aspirin, it doesn't matter. They should chew it up. That will help as well.
Can I ask a quick question?
Yeah.
Is that something we should be doing preventatively at a certain age every single day, and should we be carrying them in case?
Well, it's a good thing to carry if you're somebody at a high risk for heart disease and you hit the age 50. Your doctor will tell you to take an aspirin, but it's not really something that everyone needs to do.
Okay.
If they're not conscious and they're down, you want to start CPR, and you don't need to breathe for them anymore. It's just doing the chest compressions to the beat of staying alive. You know, we've done those segments before.
Right.
Remember that. And then lastly, an AED, the external defibrillators. Those are available at a lot of sports places, airports. Take that out, put that on their chest. It will walk you through it. They're designed to be used by people who aren't medical.
Lara talked about the aspirin. What other things should people be doing to reduce the chances?
Well, you know, he was playing ice hockey when this happened, and people are thinking, oh, wow, you shouldn't exercise. But exercise is actually one of the best things you can do for your heart health. It doesn't mean now that it's winter you want to go out there in sub-zero weather and be shoveling your driveway if you're not in good shape. But getting daily exercise is really important. The other thing is know your blood pressure. You know, you want to make sure that you know what your blood pressure is. It's called the silent killer because it may be high and be causing damage and you don't know it. You can go to the pharmacy. You don't have to make a doctor's appointment.
I just purchased one recently.
Exactly. Yeah, you can do it at home or just down at the pharmacy. It's free. It's usually there by the drug counter, and you can, if your blood pressure's high, go get it checked out. That can save your life.
Blood pressure, high blood pressure always leads, or it just causes organ damage?
Yeah, it can cause damage to your heart, to your blood vessels, to your kidneys, and people won't know that it's high if they don't look.
Really important.
And it's not about exercise, about the intensity, I assume.
Exactly. Yeah. You know, you can exercise as intensely as you want, but a lot of people who aren't getting exercise all the time, you want to take it slow. You want to get checked out before you start out, but don't ignore the exercise. It's really good for you.
Great advice, Doc.
Lots of good advice right there. Thank you.